Access to Medicine's platform is a non-profit organization which works with partners and multi-stakeholders in contribution to achieving sexual and reproductive health and rights. We do this by creating a strong civil society that engages effectively with the government, the private sector, and other stakeholders accountable for health systems with an aim to deliver equitable, accessible, and highly quality sexual and reproductive health rights and services.
Access to Medicine's platform came out of a desire for us to find a way in which we can engage communities in the work that we do. And primarily our work is focused on sexual and reproductive health and rights, using evidence, getting the voices of communities in the implementation of the work that we do, and making sure that the voices of community-based organizations are represented in the policy interventions, in the discussions, and in the discourse that goes around at higher levels in terms of ensuring that there is sufficient budget allocation and people have access to life-saving commodities, particularly for reproductive, maternal, and child health.
Access to Medicine's platform was established in October 2016 and formally registered in Kenya in January 2018. Since then, we have been working with our partners to realize our vision of a country where everyone enjoys optimum health and rights, particularly sexual reproductive health and rights. Our main interventions include evidence-based policy and budget advocacy, multi-stakeholder engagements, media engagement, research/evidence generation, capacity strengthening of grassroots civil society organizations, as well as community engagement. In advocacy, Access to Medicine's platform recognizes the need to prioritize sexual and reproductive health and rights at all levels of policy formulation, implementation, planning, and budgeting. We have implemented our advocacy interventions in collaboration with local community-based organizations, also known as CBOs, in various counties across Kenya. Our multi-stakeholder approach is different as we go beyond just talking about issues. We facilitate roundtable discussions between multi-stakeholders from private, public, mission sector, academia, and CSOs network to generate innovative solutions to the tough problems of supplying the right services and medicines in hard-to-reach areas and marginalized groups at the right prices for the right quality and in a timely and accessible manner. We support national and county-level multi-stakeholder dialogue space which strengthens governance and promotes a rights-based approach. We also provide high-level strategic multi-stakeholder partnerships to lobby and advocate for strengthening policies and processes that support reproductive, maternal, newborn, child and adolescent health. The media plays a key role in disseminating information, educating the masses, and health reporting on emerging issues of human interest. Access to Medicine's platform has increased its media engagement so as to create more awareness and visibility of a range of health topics including maternal, child and adolescent health, snakebite incidences, as well as mental health policy, care and treatment. In our work of conducting evidence-based advocacy interventions, research is one of our key technical strategies. The outcomes of our capacity strengthening interventions include formation of a vibrant youth-led CSOs network in the Lake Basin region that after 3 years is now engaged at the highest level both at the County Ministry of Health and County Assembly. Our trained CSOs in Kisumu, Kakamega, Kwale, Narok, Kajiado and Kiambu counties have advocated for the development and enactment on key policies for sexual and reproductive health and rights, including health bills as well as adolescent sexual and reproductive health policies. We have also trained CSOs in Kajiado and Busia counties and through their advocacy efforts influenced the establishment of youth-friendly centers. Through our trained CSO partner, Youth Alive Kenya, more than 50 youths in Kiambu County were trained on budget advocacy and social accountability. As a result, social accountability forums are formed and community scorecards administered in 6 sub-counties. Trained CSO partner Afya Africa advocated for the implementation of the Return to School policy and ASRH policy in Narok County. Under community engagement, Access to Medicine's platform seeks to ensure that community voices are represented in policy formulation and at the decision-making levels. For communities to hold duty bearers accountable, they need to be aware of their sexual and reproductive health and rights. Through our CSO partners, we held community engagement sessions at the lowest level. We have supported community dialogues, youth empowerment and educational forums and sensitization on sexual reproductive health right matters, social accountability and public participation. We have also effectively organized County World Health Days, including World Contraceptive Day, Day of the Girl Child, Day of the Youth and World Mental Health Days. In addition to that, we have also supported our community-based members to participate in radio talk shows in the local dialect so as to reach out to even the most marginalized with information on reproductive, maternal, child and adolescent health, as well as the Ministry of Health messaging. Our vision is to see a country where everyone enjoys optimum health and rights, particularly sexual reproductive health and rights.
We feel Access to Medicine's platform is really filling a gap that is real and that exists in our country today. We are providing that opportunity for the community voices at the lowest level in every corner of this county to be heard. We are really advocating for decisions to be made based on the needs in the community. We believe that one size does not fit all, and that is the reason why we prefer to work in the county and come up with strategies through our multi-stakeholder platforms that are not only listening to the voices of the communities, but are basing the policies, the discussions around evidence that has been collected that is very specific to these counties. So
to partner with us, please reach us on info@atmplatformkenya.org. Visit our website at www.atmplatformkenya.org.